good evening and welcome to our COVID-19 update. I am Ladi Akeredoluale. Here are the highlights at this hour. Canadian and U.S. research says that over half of COVID-19 infections worldwide are silent. Nigeria Immigration Service denies departure to 58 Nigerian doctors trying to go to the United Kingdom. And South Africa prepares facilities for a large surge in cases of COVID-19, just as the WHO announces a record-breaking day of increase in cases. We begin tonight with a report that says silent transmission could account for more than half of the COVID-19 cases diagnosed globally. And that's according to a study by researchers in the United States and Canada. In one of the researches published in the journal PNAS, medical experts leveraged on data obtained from cases of the virus that resulted from both asymptomatic and pre-symptomatic transmissions. Someone who is asymptomatic has the infection but no symptoms and will not develop them later. But a pre-symptomatic patient has the infection without symptoms but will develop them later. According to the study, more than 50% of the infections recorded were attributed to people who didn't exhibit any symptom. Another study conducted in an Italian town and published in the journal Nature found that about 40% of positive patients had no symptoms after the majority of the residents of the town were tested. In the verdict, which they claimed could have a real worldwide implications for leaders fighting the virus, the experts say mass testing, isolating infected people, and lockdowns could limit the COVID-19 spread. According to the studies, understanding how silent infections that are in the pre-symptomatic or asymptomatic phase contribute to transmission is fundamental to post-lockdown strategies. Accordingly, they do say a vast outbreak may nonetheless unfold, adding that more than 12 million confirmed cases of COVID-19 have already been reported globally, with more than 500,000 deaths. The Nigeria Immigration Service says it has refused to allow 58 Nigerian doctors heading to the United Kingdom to leave the country. The Immigration Service spokesman, Mr. Sunday James, says in a statement that the doctors had concluded plans to leave the country via a special flight at the Murtala Mohammed International Airport in Lagos. He explains that only 2 of the doctors had visas, while the other 56 did not. He says the 58 medical doctors were refused departure in line with Section 31, subsection 2A and B of the Immigration Act 2015, which prohibits departure of any person under the conditions stated in the Act. He adds that if the doctors had been allowed to leave the country, they could have been repatriated to Nigeria immediately. President Muhammadu Buhari has signed into law the revised budget 2020 of 10.8 trillion naira following its passage by the National Assembly. The signing, which took place inside the council chambers of the State House in Abuja, were the Vice President, the Secretary to the Government of the Federation, and Chief of Staff to the President, amongst ministers and other government officials in attendance. The National Assembly had passed the revised budget, raising the total estimates to 10.8 from 10.5 trillion naira sent to it by the President.
The 2020 amendment budget, which I have just signed into law today, underscores our administration's firm commitment to effectively contain the spread of COVID-19 and protect the lives and livelihood of our people. With these budget amendments, as well as our recently launched 2.3 trillion naira stimulus program, we are well positioned to safeguard the economy. Considering recent budget implementation challenges, I have directed that efforts be made to assure effective implementation of the Appropriation Repeal and Amendment Act 2020 in order to realize its laudable objectives. The Federal Ministry of Finance, Budget, and National Planning is in the process of effecting budgetary releases that will ensure that all ministries, departments, and agencies receive at least 50% of their amended capital budget by the end of this month.
The National Emergency Management Agency, NEMA, has commenced distribution of palliatives to 64,000 households in Edo State. The package also includes fertilizers for over 3,000 farmers who will also get fertilizer support as part of the federal government's efforts to cushion the impact of COVID-19. The Director General of NEMA, Air Vice Marshal Mohamedou Mohammed, who disclosed this at the Government House in Benin City, says the special intervention was approved by the President.
Residents of Benin City in the Edo State capital wriggling it out in the era of COVID-19. They lament the increase in prices of food items, transportation, and general cost of living. But now there's a sigh of relief clearly visible on their faces as the National Emergency Management Agency commences the distribution of food items and fertilizer to households in Edo State.
The food items allocated to Edo State are maize, 323.29 metric tons, which is equivalent to 11 trailer loads. Gari, 156.51 metric tons, equivalent to 6 trailer loads. These are palliatives that are expected to cater for 64,613 households.
In response to the gesture, the Edo State Governor, Mr. Godwin Obaseki, explains that his government has already earmarked the most vulnerable persons in the state to ensure smooth distribution.
The distribution is usually done in association and cooperation with religious bodies, with community leaders who help us identify the people who are neediest and who have suffered the most brunt of this pandemic. So I want to assure you that it will get to the people it is meant for.
No doubt these items will go a long way in providing succor to these families. What is, however, important is for the items to get to those really in need at such a time as this.
COVID-19 has put a spotlight on the important role nutrition has in supporting the immune system relative to viruses such as this. As inaccuracies related to immune boosting powers of certain nutrients or supplements circulate, ensuring that only science-based factual messages are being conveyed is becoming very challenging with the use of social media. The idea of boosting immunity is enticing, but the ability to do so has proved elusive for several reasons. Experts say balance and harmony is needed for the immune system to function well, and getting that right balance is what many have found difficult to achieve. Today we look at how to boost the immune system and healthy ways to do so. I'm now being joined by Professor Elizabeth Ungu, who is a professor of human nutrition. She's the current head of the Department of Home Science, Nutrition and Dietetics at the University of Nigeria, Nsukka, as well as being the national president of the Association of Nigerian Dietitians. Good evening, Prof. Thank you for your time. Professor Ungu joins us from Enugu, VASCAP. Good evening, Prof. Thank you for your time.
Good evening. Good evening, viewers.
How important is it, how important really is this issue of diet to boosting one's immunity?
Yeah, diet has been a very important aspect of treatment of diseases. And we know that the immune system is the soldier guarding the body of every human being. If one has a strong immune system, the chances of the body getting infected by microorganisms is very much reduced. And even when the body gets infected, it is the strong immune system that will fight the disease. And the result at the end will be that the person will not die, and the length of hospitalization will be reduced, the severity of the disease will be reduced. So in other words, diet is very important, and diet, I mean adequate diet, adequate healthy diet is very important to build our immune system.
At that point, I guess everybody would say, well, at one point in time or the other, they're able to follow this discussion up to where we are now. But there are differences. Those who are older and those who are most vulnerable to COVID-19 have problems with eating. Most older people do not end up eating much, whereas younger people eat a lot, but not necessarily enough of what is needed. How do you go about tackling those two things?
Yes, you're correct. Elderly people have problems eating, and when we talk about eating or adequate diet, it's not just eating anything. Foods are grouped into 6 or 7 groups. And for one to eat adequately and healthy, foods must be collected from different food groups, within a food group and across different food groups. You select foods from these within the group and across the groups so that you'll be able to make adequate diet that will supply the necessary nutrients in adequate amounts and quantity to be able to meet up with the individual's requirements.
There are those who say that they don't really have the time to follow all these specific things, and therefore they just go to the pharmacies and they pick up herbs or supplements that are promised to boost your dietary system. Is that healthy? What's the difference between that and what you were saying?
Sorry?
I said there are those who would say that they do not have the time to follow the strict dietary patterns and the various foods that will be identified as helping immunity. They just go to pharmacies and they pick up herbal or vitamin supplements and they take those. Is that healthy?
No, it's not healthy because no supplement, no nutrient has been found to give adequate diet. Person must eat a well-prepared diet that is made from different food groups. And that is why Nigerians need to be given nutrition education. We need dietitians in primary health centers, secondary health centers, and tertiary health centers to educate them on how to select their food. Going to the pharmacy will not help us. I want to remember the quote of a Greek physician who said, "Let your diet be your medicine, and your medicine your diet." Let our pharmacy be our grocery. That means we have to choose food from what we produce. Vegetables and fruits are very important sources of minerals and vitamins, which do a lot of work in our body. They help the immune system to be strong, and the immune system is the system that will help us fight infection and prevent infection when it comes to that. So, like I said, we have different food groups. So, foods must be selected from different food groups. You have legumes, there was a problem. So we have to select from legumes, we have to get nuts, cereals, carbohydrates, meat, and milk, fruits and vegetables. So Nigerians must learn to eat a lot of fruits and vegetables to meet up with the requirements of vitamins and minerals, and even fiber. Fiber plays a lot of role in our dietary habits and in our health.
All right, then. Thank you so very much, Professor Elizabeth Ongo. Thank you so much for your time. Professor Ongo is the president of the National Association of Nigerian Dietitians. She joined us via Skype today from Enugu. Healthcare workers handling COVID-19 patients in Niger State are also not spared from the virus and stigmatization from members of the public. But in spite of the danger, some of them at isolation centers in Minna say they are not afraid of caring for their patients. Here's our correspondent, Emperor Simon.
At least 14 health workers have been infected with COVID-19 in Niger State, some in the line of their duty, while others are imported cases from various states across the country. A statement from the Niger State Task Force on COVID-19 says all the health workers have, however, been treated and discharged. We decided to come to the isolation center here at the Minna General Hospital to hear from those at the front line on how it is like to work in a place like this.
At times when I told them that I work in an isolation center, they tend to run away from me. Some people say, don't touch me or don't come and infect them. I started laughing. There is nothing, no, nothing happened to me. Because our work is to take care of the patients. We are a nurse. If people are not there to take care of those patients that are infected, who is going to take care of this? How that we just leave them and die?
There is risks, quite sure, but when you take to the precaution you are supposed to take, you are free and you are safe. And even when I get home, before the children come close, Mommy, I will say, wait, let me wash my hand. I'll have to pull everything, wash my hand, then we'll now sit down and gist.
At the moment, Niger State has a total of 125 confirmed cases of COVID-19. That figure is drawn from the over 917 suspected cases that have so far been recorded. We know at the moment that the state government says it has completed the 14 days follow-up for 423 contacts, while 7 are still being followed up. From the isolation center at the Minna General Hospital, Emperor Simon for COVID-19 update.
Now let's look at the COVID-19 figures as released by the Niger Center for Disease Control, the NCDC, in the last 24 hours. The agency announced 499 new cases of COVID-19 recorded in 23 states and the Federal Capital Territory. As you can see, the figures on the channel's television COVID-19 case monitoring dashboard, the total number of confirmed cases in Nigeria is now 30,748. 30,748. And as we did say yesterday, if you take out those who have recovered, that is 12,546 from this number, this is what you will get, especially when you subtract the deaths, which has also risen to 689. So you've got 17,513. This is the figure from across the country. Now, let's take a look at one of the states where there is some level of statistic. This is Kwara State in Nigeria's north central region. And immediately from what we can see on the screen here, the major points of infection as at now, anyway, is around Ilorin. Ilorin, of course, is the capital of Kwara State. But if we take a look here at the LGAs, Ilorin West is easily one of the most affected. In fact, it's got the biggest figure. Point of note, though, these figures are as at June the 24th. Those are the last days we had the figures from. And you can see that from Ilorin West. Everything is around Ilorin as we have it right now. Ilorin West, the biggest. Then you've got Ilorin South, which you also have the figures there at 73. And then you've got Ilorin East at 30. This is it. And maybe, of course, this is because of testing. We do have difficulties with testing across the country. Not enough testing has gone on. If more tests were carried out, maybe other places in Kwara State will be affected. We'll talk a bit more about this and indeed other figures right after the break with our guests. So please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. To look at the potentials of the newly developed and validated Indigenous test kit for the identification of SARS-CoV-2, the causative agent for COVID-19, and other issues around Nigeria's COVID-19 response. I'm being joined in our studios by a public health expert who is also an epidemiologist, Dr. Peter Nzako. Dr. Nzako, of course, is also a pharmacist. Thank you so much for joining us.
Thank you so much, sir. Yes, sir.
So many people, between yesterday when we reported this and today, so many people have said this may be the breakthrough we had been looking for. That because if we have an indigenous test kit, then it shouldn't cost us so much to conduct tests, and therefore we should do more tests. Is that reasonable from a medical point?
Yes, of course it's reasonable.
Okay.
And to me, it's the beginning of breakthrough for Nigeria.
Okay.
We should look inward. We have a lot of epidemiologists on ground, microbiology, lab scientists, medical doctors, trained from infectious background. I mean, I'm talking of infectious prevention and control experts.
Okay.
And so therefore, we can conveniently have our indigenous test kit that we developed. I have a friend who even is good in it, that has even developed one of the test kits. And he gave a proposal to the state government. Where I come from? It's an academician. And therefore, if all Nigeria can embrace these people, encourage them, because we have brain in between us, who are even trained from abroad, trained between us, and they came back again to give what they have impacted. You know, one of the cardinal points, if you're going to abroad, they will ask you, why do you want to have this knowledge? And one of the cardinal points is for you to return back to your country and give, because already we're lacking. And so for us, let's see what they are seeing, and let's bring it to our people so that they can equally see what they are seeing. Right. And so therefore, to me, it's a very factual background. Now, this will be the genesis of the breakthrough. Imagine Nigeria with about I'm talking about 205 million, based on the present projection.
Right.
We're talking of only 175 test kits, 175,000 test kits. We're talking of 656, which is, as of today, as of yesterday, it was 171, 951 test kits. I mean, samples tested.
Tested, yeah.
So you can imagine the thing just increased marginally to about 175, which will have additional 4,000 and some fractions. That shows we're not effective. We're talking of a population of 205 million. And then this thing is rapidly increasing at a geometrical rate every day. Where I work, it is amazing. But I want to invite you, don't disclose your identity. Go to Port, Apapa Port. Go to Tinkan. You will see people are not even wearing face masks. Nothing is being done about it. And this is the genesis. When there was COVID lockdown, the COVID-19 lockdown, a lot of people are working at the port because based on the presidential declaration and executive order, they were working there. And then there was like a certain attitude towards health. So what we're interested is that there should be advocacy, increase in advocacy at community level, with the stakeholders involving even civil society organizations, faith-based organizations, and other major stakeholders. We're also looking at communication, health communications, which is very important. Health education is very important in sharing of information. Knowledge, we must increase the momentum, the quantum, so that people can be educated. People can have their health at their palms with this. And with the test kit, which means Nigeria should think of an idea of having test kit or testing 5 million on a monthly basis. We have no regret. We have the resources.
We had a projection.
Now Lagos is trying.
Yeah,
Let me comment.
I'm sorry. What I even wanted to say was that we had a projection. The NCDC gave a projection of 2 million about some 8 or so weeks ago.
They said by end of July. But which is not yet. We're expecting 2 million. We're waiting.
We had 175.
Thank you.
By what you
now you can see incapacitation. Not NCDC. I want to praise them. I'm not a sycophant, but they are trying. But I can see paucity of funds and incapacitation is affecting their flow. And we have a lot of brains within NCDC, but they underutilize. At least as an expert in public health, with PhD in public health, with also postdoctor of science in epidemiology and research, and also with postdoctor of science again in public health itself, and a student and a graduate of MSc infection control. No. An MSc again public health.
What is it that we're doing that seems to be, because I've asked people who have sat in the chair you sat, and I've said, at first, it was that we didn't have the capacity to do the testing. We didn't have the kits, we didn't have the labs and so on. Now we are told we have 40 labs. Some of those labs, as we hear from the health minister and from the NCDC DG, are virtually empty. They are not working. People are, and the reason is that people are not coming out to give themselves or to give themselves their samples up. So you don't have people to test. You don't have it. And now you mentioned something before we came on air when you talked about asymptomatic and pre-symptomatic, which we started the bulletin with. So even if we are not doing any test, it doesn't mean that our numbers are staying low, does it?
No. Yes, what I wanted to let you know, you see, the lack of political will from the angle of the government. Let me take, for example, in healthcare financing, and as a student of health economics, you understand that 70% of budget from the revenue account is dedicated to health. UK is an example on its National Health Service.
Yeah.
Canada is another example on its own Medicare, Medicaid, I mean. US is another example on its own Medicare program. And Germany is an example. 70% of their budget from the revenue account goes straight to the health, which means everybody is sitting right. And that's why you have longevity, high life expectancy, better economy. Do you understand what I'm saying? Economy is synonymous to poverty. It determines education. These are two things. Education, economy, these two things are synonymous to poverty. And so therefore we must address it from the background. Now with this politics of COVID now, people don't even believe that it's COVID. Now you can see it has turned out to be a disease of the big man. Especially those that have accumulated and they're already more than 50. Now you can imagine, 80% from the statistics, 80% of the COVID is between the age bracket of 31 to 40 and possibly 50. And they are doing well. They are coming out of it.
Yes,
they
are
recover
recovering.
fully because of the immune system. It's stronger. Those aging, the immune system is already weak. And so therefore, they are fast grappling with the realities of the death. And it's easier because it outweighs the immunity. And of course, you'll be down immediately. And as you can imagine, sorry to say, and I want to sympathize with the family of NAFDAC board chairman, the former Minister of Sport, Alhaji Inu Abdulkadir, who died from the same complication. A fine man, a young man, an intellectual, you know, a lawyer by profession, very sound and intelligent, very handsome. But look how. It's a pity. I sympathize. It pains me. He's a personal friend. I know him one-on-one. I know him. Down to his house.
But he is one of 600 plus people that we have lost.
Yesterday, it was 684. Out of this, as of 544, no, 54, it was 689, which means we have additional 5 deaths injected into the system. Now we're having the statistics as of yesterday, the total confirmed cases, we're talking of more or less like 30,000.
Yes, above 30,000.
Thank you.
Above 30,000.
Of course, we're talking about 327. And now today, we're having 30,748.
That's right.
Now globally, we can understand that it is about 12,101,328. With total death of 551,000 and 46,000. That shows the statistics is increasing. Now, looking at this from the statistics, you'll be able to understand that COVID is increasing in geometrical progression. But this is the situation. Let me provide the solution. The solution is this. We're already into the pandemic.
Right.
And the workforce has resumed, especially from the private sector, and marginally from the public sector. And we're containing it. What we need is the strengthening of the institution. Access to available test kits. We're not talking of, it's not about 175,656. It's not enough. It's underfunded. Now, also, we're also looking at the issue of, apart from our advocacy, the strengthening of the health institutions, establishment of test centers across all the 36 states of the federation. It won't take federal government anything. It won't take state government anything. I want to applaud Lagos State Governor for one thing. All the test centers were established in all the 20 local governments.
Dr. Nzaku, I'm going to have to
Thank you,
put
sir.
a stop there. Thank you so much.
Thank you so much, sir.
Dr. Peter Nzaku is in our Lagos studios here. He's a public health physician. As you heard earlier, he's also a pharmacist and he's an epidemiologist. Thank you so much.
Thank you so much, sir.
Tonight.
Thank you, sir.
The Ministry of Education in Ekiti State wants all conditions for safety met before saying a final yes to any date set for schools to reopen. The government is also open to positions taken by the federal government on the West African Examination Council papers by Nigerian candidates. Details from Babajide Agbeyo.
The resumption of schools in Ekiti State, fixed for the 20th of this month, is tentative. The State Ministry of Education has said that this will only happen if all the rules set for it are complied with. These rules will include fumigation of all the schools in the state, clearing of all bushy environments around schools, and the provision of all items necessary to ensure proper hygiene within all the schools. Worship centers are also gradually warming up to resume activities. There have been meetings to that effect with religious leaders, and they have given their words that they will do all that the state is asking for in the name of safety. And the state government is looking forward to that so as to give a nod of approval for religious activities to start again. The State Task Force on COVID-19 has said that community testing is in progress across the 16 local governments in the state. And for now, the discoveries are not yet alarming. But the community is sensitizing and prevailing on members of the communities to show cooperation towards the exercise, as it is put together in the best interest of the people and the state. So as it is, the state is getting dynamic, trying to attend to situations and developments just as they unfold. Babajide Agbeyo for COVID-19 update.
We're still taking on the discussion on the COVID-19 situation in Nigeria. I'm being joined now via Skype from the Lekki area of Lagos by a public health physician, also a member of the Association of Public Health Physicians of Nigeria, Dr. Doyin Odubanjo. Dr. Odubanjo, thank you for your time this evening. Welcome to the program.
Thank you very much. It's a pleasure to be with you.
Do you share the general optimism on this launch, this discovery, or this outpour for the Indigenous test kit that has just been unfolded, particularly against the backdrop of the continuous talk about the need for more testing?
Well, I'll call what I have a cautious optimism because I'm happy, one, that we're looking in the right direction, which is that we are beginning to understand. But for this disease, for this pandemic, every country needs to look inwards and solve its own problems, create its own solutions. So I'm happy about that. I'm happy that has happened. I'm a little cautious because I'm yet to hear from the Ministry of Health. Maybe I've missed it, or the NCDC. I've not really heard their own optimism, about what's been developed. And I'm wondering about the collaboration between the agency that developed that and those who are in charge of control. So, but again, I think it's still a step in the right direction. So it's something we should be happy about. We are happy about. And we look forward to this moving forward, positively. It would help the situation largely once we can get our own test kits in. You may recall that we've had test kits even donated long ago, many weeks ago, but they've not been used. And that's because of validation. And that's because there are many factors that would affect the use of those test kits. Sometimes they may work somewhere, but not here because of environmental factors and all. So the best solution is what we develop here. So this is a very positive step indeed.
The federal government took a step forward when it said that graduating students of primary and secondary schools could return to school. And depending on who you speak to, some say they then developed cold feet, or they were then given advice by people like yourself, which indicated that that may have been a wrong step. Where do you stand on the reversal of the decision for schools to open and the strong warning to states not to contemplate the same?
Well, again, I would actually I think what is really bad about it is the fact that the decision was made and was reversed very quickly again. And what's bad about that is that it makes you wonder about the coordination, and who's talking to who and who is not talking to who. I think that's the real issue there. It's not so much about the decision. Remember, there are no easy answers in this thing we're dealing with. However, what I would say is this, is that if you want to know whether schools can resume, we need to assess that by the readiness of the public schools themselves to provide a safe environment. Private schools are largely going to do whatever it takes to resume and resume safely. But the government making the decisions and the policies needs to use its own schools as the yardsticks. That is, by that, I mean, do the public schools themselves have running water? Can they do this, the social distancing? Would they have sanitizers? Would the students have face masks on? Would the teachers have face masks? So those are the questions to ask. If we can achieve that in the public school, I think we can go back to school. Remembering that COVID is not about to go away next week.
Finally, before I let you go, I must ask your view about the reopening of domestic aviation. We've had 3 days of it now. So what's your take on what has happened, adherence to protocols and the debate that has been generated by the issue of social distancing inside the aircraft?
Well, I think it's a huge challenge. It's a huge challenge, and it's not just aviation. It's a huge challenge we're facing generally. It's the battle between the actual pandemic and the economic pandemic. I think that's the real problem right there. Because again, if you keep asking or if you keep pointing at the figures and you say cases are rising, then you ask, why are you easing things around the country? It's because the economic issues are rife. And would threaten livelihood and indeed life itself if we're not careful. However, looking back, and I think this still takes a bit of analysis, we haven't had actually so much of the cases that we have had come even when the borders were open. We didn't see them coming from the planes. As a matter of fact, this is just anecdotal observation, but what we did have were a lot of cases who got it from people who traveled, but not the people on the plane with those passengers. So there are things to research, there are questions to ask. Is it possible, indeed, for us to go back to normal, as it were, and put in these measures, and the measures will be sufficient to protect us going about our normal activities? And that is a possibility. We'll have to wait and see. But I think the measures are important. I think it's also important to go back to life as much as we can, safely. And I think that's what we're trying to achieve now.
Dr. Odubajo, thank you so much for your perspectives on this developing issues. Thank you for your time, and do have a good weekend ahead. Stay safe.
My pleasure. Thank you.
The World Health Organization has reported a record increase in global coronavirus cases, with the total rising by 228,102 in just 24 hours. The biggest increases were from the United States, Brazil, India, and South Africa. Our South Africa Bureau Chief, Betty Dibia, reports on the situation in South Africa.
With over 2 million COVID-19 tests done so far in South Africa, Gauteng province has become the epicenter for a second time. The Tshwane District Hospital, linked to the Steve Biko Academic Hospital, was inspected today by the Health Minister, Dr. Zweli Mkhize, accompanied by the Provincial Health MEC, Dr. Bandile Masuku. The tour was to see the level of preparedness for the ongoing surge in infection numbers.
We're just demonstrating and also indicating that the capacity of our hospitals, as it's continuously building on, because it's not static, it's not going to be finite, we're going to be continuously building on it as we go, as we respond actually to the pandemic.
It should have been Gauteng over the past few months that's been having the highest numbers based on the population size. So what we are seeing in Gauteng is not surprising. Of course, we must always remain very concerned and vigilant by the rising number. This basically means that we are now going to be seeing what we call the peak of the epidemic.
A lot of effort, the minister says, is being put into making more beds available for COVID treatment. The Council for Scientific and Industrial Research has also been contracted to provide 20,000 additional ventilators for facilities. Asked about stories making the rounds on social media about COVID treatment discrimination against foreign nationals, Dr. Mkize says he knows nothing about this, but insisted that any specific case brought to his knowledge will be handled accordingly.
There's emergency treatment that we give to everyone, and therefore I'm not aware of this particular one. But, South Africans here have actually been concerned about whether increasing numbers is going to mean that they also can't get access to hospital. We're saying we're increasing the hospitals. So if it's too generic, it can't be answered. So what I request you do, give me something concrete, because people can make any claims out there. I cannot deal with that. I can only deal with a name and a person so that we can find out which hospital, what happened, and we know what the circumstances were.
The health minister also says he has written to the National COVID Command Council over how alcohol-related cases are putting undue pressure on health facilities which could be dedicated to COVID care. This is a concern shared by the Gauteng Premier, David Makura, who has now tested positive to the virus, the third in a row after Northwest Premier, Professor Job Mokgoro and Alan Winde of the Western Cape Province. From Johannesburg, South Africa, Betty Dibia, Channels Television News.
Some grim statistics there. Well, Betty joins us via Skype now from Johannesburg, which is the capital of the new epicenter, that's Gauteng Province. Hi, Betty.
Hello, Laddie. Good evening.
The situation seems to have shifted from Western Cape now to Gauteng, and some have already said that is how it ought to have been at the beginning. But I guess the more grim news is that the peak is arriving much earlier than was anticipated.
Well, yes, the minister has admitted that the main reason or the main challenge is that there are too many people who are asymptomatic and they're moving around not knowing their status are probably infecting other people. And the issue of people not adhering to the protocol or the regulations on, just keeping safe. And added to that is the season. It is winter already in South Africa, and this is going to go until probably early September. So the minister says at this point, you have the peak coming in June, well, it started in June, July, August, and probably up till early September. So they're trying right now to beef up what they've already done. Their search strategy includes scaling up testing capabilities at the laboratories and also making bed spaces available. Although some of the testing facilities in the private sector, like Discom, which is a local pharmacy here, saying that they're shutting down their own facilities because they didn't anticipate the kind of surge. In Gauteng alone, within a week, you had over 15,000 new cases. Generally in the country, they've tested over 2,057,000 plus people. So it's a situation that they're hoping they'll be able to handle with the help of the people, probably changing attitudes. And hopefully things will get a bit better and numbers may start dropping when the temperature gets better.
Given that background, though, what is happening in terms of strategy? The last time we spoke, you did talk about the National Command Council, which is another name for the South African cabinet, trying to find out what exactly it is that they will do with respect to Gauteng. That's even before it became this bad. Have they come to any conclusions?
Well, we haven't heard much. Only what we're being told at this point is just strengthening what's already on ground and trying to make space for COVID cases without neglecting other cases, because other people still use the hospital. You have some of the facilities with a triage tents where you're able to sort out in terms of priority for admission of cases. So we're still waiting to hear if anything is going to change, but right now it's just beefing up capabilities. Most of these triage tents have ICU, IV, and oxygen administering capabilities. So they're hoping to use all those things on ground, make more bed spaces available, and ensure that other things that would distract attention from attending to COVID cases will be minimized, especially the issue of alcohol or alcohol-related cases, putting a strain on facilities already. But we're still waiting to hear from the National Command Council, which hasn't really spoken very recently, just the ministers, different ministers speaking on particular issues. Hopefully, they will let us know what next will be done.
Thank you very much, Betty, South Africa Bureau Chief, Betty Dibia reporting there from Johannesburg. Do continue to stay safe.
Thank you very much, Ladi. You too.
On the NCDC website, you can find the latest national strategy on flattening the curve as the website comes alive with all information and statistics. Also, do go to the WHO, that's the World Health Organization website. It gives you regular updates about the spread of the pandemic as well as strategy guides for response at national and subnational levels. ChannelsTV.com is your home for the news, whichever news that is. That's all on our COVID-19 update for this week. We'll bring you up to date with the latest happenings from Monday. I'm Ladi Akredoluale. Good night.